Welcome everybody back to my channel. This is Dr. Tosin, and today I'll be taking the COVID-19 vaccine and I'll be walking you through my experience. So this is another episode of my Day in the Life series as a medical doctor and a GP trainee, and I usually start my morning out by making a filtered cup of coffee, and I go and have a seat and I start practicing my morning routine, which includes me going through my journaling and writing out my to-do list, amongst other things. I will be doing a complete video of what my morning routine really looks like, and I'll be putting out there in the next year. So essentially just write out my thoughts for the day, plan what I think I need to do, pick up my specific highlight for the day, what is mission critical to achieve. If I can, usually write it down, possibly in the middle of the day, forget about it completely, and open it down at the end of the day and say, oh, what's going on there? Anyway, going on, finish writing out my journaling and write down. I've started taking out a meal prep to work, and this has to be prepared in the morning. So while I've done that, I go out and I put the stuff on the fire in the kitchen and let that boil on the fire. It usually takes about 5 to 10 minutes for everything to get ready. So during the time I'm doing the meal prep and getting everything ready, I also try and hack and carry out my 5-minute workout routine, which essentially is a 5-minute Tabata workout. And I'm able to get that done, sorted, get ready for the day. And after I've done that, it's time to head out to work. So my drive to work usually takes about 45 to 47 minutes, give or take. This is enough time for me to listen to my podcasts or an audiobook, depending on which one I'm having at that time or what the general mood and feeling is. I arrive at work, get in there just around 8:30, just in time to get in, get ready, get changed to start my day, which involves me making phone calls to patients and starting to plan to see patients either face-to-face or refer them if necessary. And also crack through my list of blood tests, admin notes, and the likes. Quite a lot to do anyway. So yeah, guys, today is the 17th of December and I'm getting the COVID-19 vaccine today. At least the first shot is a 2-shot dose given 21 days apart, and I'll be getting my first shot today. Because of the practice policy, unfortunately, I'm not actually allowed to video the live injection itself, but I will be showing you the spot where I've gotten it on my left arm. It's my non-dominant arm, and that's where I usually take all my jabs on, just because of the post-arm soreness that tends to come after most injections. And I think people have reported that that's probably going to be the case. So yeah, so it's a normal surgery day. Work will continue as normal. I'll be taking it after surgery in the evening, I think about 6:20. And but yeah, we'll have a discussion about what the vaccine is and what it is not, and see if we can allay the potential fears people have regarding taking the vaccine. Right, guys, one of the benefits is that we know that the vaccine has been tested in roughly about 40,000 people in the clinical trials and has been proven to be effective in reducing your admission of severe pneumonia cases from COVID-19 infection itself. What we will find over the next couple of weeks, months, and maybe years is whether it reduces the level of transmission. Now, that data is not 100% clear yet, but we believe it will, but we just need more concrete data to support that. And yes, this is an mRNA vaccine, so it's technically a synthetic type vaccine, which are the new type of vaccines that have come out, as opposed to the DNA type vaccine that other companies are discussing and are bringing out. Should you wait for that one? I'm not going to be the judge of that, but I'm a frontline worker, and as someone who's also a Black and ethnic minority who technically is put at high risk, I'll be wanting to get the vaccine to help support my family. In fact, I do not want to be bringing infections home, especially going into the winter months that we're going into. And yeah, let's see how it goes. So I start the day by going through the patient forms that were submitted from either the day before or that morning to speak to patients or address their problems if I can via the online system, or answer their queries, some surrounding the COVID-19 vaccine. And one thing I found, and I should point out, is that the mRNA vaccine does not alter DNA particles as may have been suggested or inferred. We so far do not have any scientific basis for that. we're heading down now, going to have the COVID vaccine. So one vial usually gives about 5 doses of the injection, and prior to taking the injection, you get asked the standard questions about allergies, infections, or whether you've been unwell previously before coming to have the vaccine. Bye. Just being jabbed. Just came in and had the jab there. Man, painless. We'll find out tomorrow. So you get this as a healthcare worker, you get a copy of that, how to get protected. And yes, it tells you that you've had the COVID vaccination, and also gives you the batch number and date of vaccine I've had. There we go. Now, so the mRNA vaccine is a synthetic product. So one, it ideally should not cause any allergies. Especially if you want the full content of an ingredient, you can go on the Pfizer website. It's listed there. It doesn't contain any of the eggs or things most people are allergic to. Although yes, some people have had some allergic reactions to it. I think 2 or 3 people reported so far. When you get the injection, what it does is that it kind of tricks the cells in your body to produce a type of protein that stimulates an immune response, stimulates your T cells to produce antibodies that can help fight off the SARS-CoV-2 virus. Hopefully that's what's going to happen. We shall see how it goes, and we shall get the injection again in another 21 days. And by then we'll be able to know whether, one, you can mount a very good immune response. 2, I think that's been proven that it reduces the propensity or chance of you developing severe pneumonia from the SARS-CoV-2 COVID-19 virus. Thank you guys. So that's what's happening. Hope you all have a nice day. The vaccine has been taken. I'll let you know what I do in 21 days.